Hello, I'm Dr. Charles Gatt with University Orthopaedic Associates, and I'm going to review your preoperative and postoperative instructions for your upcoming knee arthroscopy. Prior to surgery, do not eat or drink anything after midnight before surgery. Take your normally scheduled medications with sips of water during the morning of surgery unless you are directed not to do so by your doctor. Stop taking your blood thinners prior to surgery as instructed by your doctor. After checking in, you will change into a gown, vital signs will be taken, and an IV will be started by your nurse for fluids and medications. When you enter the operating room, your surgeon will be there, and several other personnel will be in the room as well, including nurses, surgical technicians, assisting physicians, and the anesthesia team. You will be transferred from the stretcher onto the operating table, and the anesthesiologist will give you some medication prior to the procedure. After surgery, you will awake from anesthesia and be taken to the recovery room. You'll be in the recovery room for about 30 minutes or a little longer after surgery. Shortly after surgery, your family will be contacted with an update about the procedure. Numbness around the knee is common after surgery and may last for up to 24 hours since local anesthetics are used during surgery. Swelling in the knee is also normal. Keep the limb elevated and use ice on an as-needed basis, 20 minutes on and 20 minutes off. Please do not place ice directly on the skin. Keep the dressing clean and dry for the first 48 hours after surgery. It is not uncommon to see a small amount of bleeding or spotting on the bandage. If the bleeding becomes excessive, then call the office. After 2 days, you can remove the dressing and shower. You can let clean, soapy water run over the incisions, but don't bathe or submerge them underwater or scrub them vigorously. When you're done with your shower, cover the incisions with a clean, dry bandage. Do not apply creams or ointments such as Neosporin, bacitracin, or peroxide to the incisions. After surgery, you can resume your regular diet as tolerated. After surgery, you can bear as much weight as you can tolerate on the operative leg. Use crutches only if you need them. You should move your leg as tolerated and to prevent stiffness and regain your range of motion. Physical therapy may not be necessary after surgery, and this will be discussed at the first post-operative appointment. After surgery, you may continue or resume your current medications unless you are specifically directed not to do so by your doctor. Antibiotics may be given through your IV just prior to surgery, but are not needed after surgery. Instructions for use of pain medication for after surgery will be discussed below. It is not unexpected to have pain after surgery. First, we'll ask you to take 81 milligrams of aspirin, that's low-dose aspirin or baby aspirin, twice a day for the prevention of blood clots. You'll continue taking the aspirin until instructed to stop by your surgeon, usually in the range of 7 to 10 days. For pain management, prescription pain medicine should be used in combination with over-the-counter medications. For mild to moderate pain, you can use over-the-counter medications such as naproxen, 440 milligrams, which is 2 Aleve tablets twice a day or on an as-needed basis, or Tylenol, 650 milligrams every 6 hours as needed. And it is okay to take the anti-inflammatory naproxen and acetaminophen together. For severe pain, you will be given a short prescription, at most 8 tablets of an opioid medication. This is usually hydrocodone and acetaminophen, often called Norco or Vicodin. And you can use this every 6 hours, but only on an as-needed basis. If you don't need it, you shouldn't take it. Prescription painkillers are often referred to as opioids, and common examples include Percocet and Vicodin and Tylenol number 3. Opioids are effective and commonly given after surgery. However, common side effects include nausea and vomiting, constipation, itchiness, and addiction. We are aware of an opioid epidemic in the United States. There's been a growing use of opioids and addiction to opioids and abuse of them in America over the past 15 years. For instance, Americans represent 5% of the world's population, but consume 80% of the world's opioids. Opioid overdose is now the leading cause of accidental death in young people, surpassing car accidents. And one of the main starts to opioid abuse is prescription opioids received after medical care, such as surgeries. Try to use non-opioid pills as your primary pain medicine prior to using your prescription pills. You can also apply ice for the painful area, and that may help alleviate some of the pain as well elevating the limb. You will be prescribed only 8 opioid pills, which is typically more than enough to manage your pain after surgery. Although it is uncommon to need a refill, if you feel as if you do need one, please contact the office to obtain another prescription. Most patients should not be needing or taking prescribed opioids after 2 or 3 days after surgery. Please do not mix your opioids with other prescription pain medications that you may already have. Do not mix your opioids with alcohol, take them while driving a car or operating heavy machinery. Reactions are common with opioids, including sleepiness, nausea, constipation, and itchiness. If you have a reaction after taking your opioid medication, stop taking them. If you develop constipation, you can take an over-the-counter stool softener. You will follow up with your surgeon about 7 to 10 days after surgery. Thank you for your attention, and good luck with your surgery.